All right, I'm just going to go ahead and jump in. I'm sure it'll be a couple minutes as people kind of continue to trickle in from the waiting room. But hello, everybody. Thank you so much for joining us. My name is Andrea Abdallah. I am a hospitality consultant and training coordinator for Ray's High Road Restaurants. Prior to my role here, I was a restaurant owner in Los Angeles for 6 years. I closed my restaurant just now in June. For, all kinds of reasons, but in my time, spent a lot of time kind of having conversations around wage equity and health insurance and how we can kind of build a better industry. And so I'm really excited to kind of be in this newer role where I'm having one-on-one conversations with folks or leading conversations like this one that I think are incredibly important, especially kind of in these times when it's so tough to recruit and retain employees. But I think it's also kind of an exciting opportunity to rebuild our industry and really think critically about why we're in the situation that we're in and how we can kind of pave a better path forward. If you are kind of new to our organization, we are a subsidiary of One Fair Wage. And so, focused on moving legislation that eliminates the sub-minimum wage and improves the minimum wage across the country. We sort of face those battles at the state and federal levels. But RAISE specifically is a coalition of restaurants and restaurant owners who not only support a higher minimum wage, but kind of just better labor practices overall. And so, it's a free membership. We just kind of ask that you come to the table advocating for these things and willing to engage in these conversations. And then sort of in return, we have all kinds of resources to provide, which include, wage compensation trainings, racial equity trainings, things kind of like this conversation. We're still sort of in the early stages of building out a Slack so that most of our community can all kind of engage and connect with one another and share resources and ideas and sort of better practices. So really excited to kind of have everyone here today. I think that there's going to be kind of a bunch of folks joining us. So I'll just ask that to introduce ourselves, just kind of drop your name, restaurant, and location in the chat, just so we can kind of see who everybody is and where you're located. And I'm going to start to kick it off to our panelists to introduce themselves. They're going to be kind of like a little bit of question and answer, and then probably about 20 to 30 minutes in, we'll open it up to the group as well, so folks can ask their own questions. I think one size definitely does not fit all, and I think that there's lots of kind of really great little things that we can glean from all three of these panelists that will definitely be relevant to you in your market, in your restaurant. So I want to make sure that we give everyone the opportunity to ask those questions as well. And so I'll open it up and you can either drop questions in the chat or come off mute and kind of make this more of a discussion and conversation rather than a monologue. So I'm going to go ahead and kick it off to Kirsten.
Hi, everyone. Thank you. I'm Kirsten. I'm the co-owner of Rebel Cheese. Rebel Cheese is a vegan deli located in Austin, Texas. We also have a production kitchen and we're getting ready to distribute our vegan cheeses. So there's two aspects to our business, our restaurant and our production. Thank you for having me.
And Kirsten, do you mind just kind of doing like a quick 2-minute intro into your model and sort of what you all do at Rebel Cheese?
Absolutely. So our model, we've been open about 2.5 years, and we've always offered healthcare ever since we opened. So from day one. And the way our model works, it's a direct primary care model, also known as DPC, which is basically a subscription model with a local healthcare provider. So you pay a flat fee each month, which is $70, and we pay half of that. And that gives our team full access to the doctor. He has an application that they can download and do telemedicine calls. They can text him. They can also meet with him, of course, in person. There are no co-pays. There are no surprises. Everything's transparent. And this covers all of their, preventative care. So it's basically your primary care visits. If you need something more than that, like a surgery or an x-ray that he can't provide, he helps his patients find reasonable costs for those things. Like same with medicine. If they need a medicine that he doesn't offer, he shops around to help them find the best costs for those items. If they need something beyond that, we also offer a plan through Sedera, and that's a cost sharing plan. And that basically covers the larger expenses like surgeries or, something, very serious that requires a lot of treatment. But the bulk of our team, they use the direct primary care, the DPC plan.
Awesome. Thank you so much. Irene, would you like to go next?
Sure. Hi, everyone. My name is Irene, and I am based here in Boston. My business is called Mei Mei. We started out as a food truck in 2012, and then we opened a restaurant. We made some sauces. We wrote a cookbook, and now we are converting the business into a dumpling manufacturing company. So we've been in this really, I think, interesting transition where we want to offer manufacturing jobs that have a lot of the work-life balance benefits that restaurant jobs sometimes don't have, while still keeping the jobs really fun and attracting restaurant people into those roles. So right now we offer a more, I guess, traditional form of health insurance, although I am also here to learn because I think we could do a lot better than what the state of Massachusetts does for us. But our employees have access to a Tufts-based health plan, and that is currently only if they work full-time, 30 hours or more at Mei Mei, but we're looking to change that again, given the changes we're making to the kinds of jobs we're offering. We cover half of the premium, and we added dental this past year. I don't know who decided that teeth and eyes were not part of the body, but that's the situation we're in. So we added dental, which is thrilling. And I guess one caveat about Mei Mei is that because of our location and the style of service and work that we do, we have a lot of folks who are under 26, who are maybe working their first job ever out of college. And so for many of them, they are coming off their parents' health insurance. They've never bought their own health insurance before. And so there's often, I think, a level of education that businesses with an older average employee may or may not be dealing with. And I guess I'll turn it over to Elizabeth.
Hi, everyone. I am Elizabeth, and I am down here in New Orleans, and I am the founder and CEO of Oyster Sunday. And the name stands for operating system. And what we are is we're a corporate office for independent restaurants coast to coast. So we offer services like financial strategy, pro forma development, investment decks, all the way to operations, steps of service, and marketing and branding and HR services to really kind of set operators up on the right foot to open their doors, as well as work with some retainer clients on communications. But my team, we were built to be remote. Pre-pandemic, we launched in October 2019, and we work with about 25 restaurants any given time, coast to coast. But by being remote, really, when it came to setting up our healthcare in-house, we cover 100% of healthcare through United Healthcare for our employees. And we also built what we're calling the Oyster Sunday Benefits Program, which is a marketplace that we built it to kind of help with any independent contractors we're working with, and then in addition to any of our restaurant partners. But it's a marketplace where we address things like preventative care, continuing education, mental and physical wellness, and culinary tools and apparel, and then family planning. And we went to vendors and really set up this marketplace of about 20 vendors that have come down on their prices that gives all employees and operators access to care that they need. And I think it speaks to preventative care specifically, was where we started. But we've rolled it out to our team and to our restaurant partners, and now made it accessible nationwide.
And I'd also like to just shout out Elizabeth and her team, who worked super hard the whole pandemic to provide all kinds of resources for restaurants who were struggling for free on her website. You can still check them out. There's all kinds of guides and things about reimagining, rebuilding a restaurant, costing things out. There's a great job posting resource on there. So just kind of want to also say it's a great resource, regardless of kind of what you're looking for, I think, across the board. I recommend checking out her website. Thank you. Cool. So I'm just going to kind of quickly dive in here. So our first sort of question is all about what I think tends to be the first thing on people's minds when it comes to providing healthcare or any kind of additional supplemental wellness program, the cold hard cash. And so, you know, as far as financial implications for both employer and employee, kind of given your individual models, what would you kind of say are the things to think about? Maybe even if you have hard numbers to share, that would be super helpful. And then maybe even a little bit about projections and how, you know, someone could go about trying to either rethink their business model or at least figure out a way to fit in whatever it is each of you are kind of working on and advocating for. And we'll just go back in the same order. So Kirsten, Irene, and Elizabeth.
Okay, sounds good. Yeah, this question, of course, is interesting. When we opened, we knew we wanted to open with health insurance, and I shopped around a lot and I met with a lot of agents, and they basically told me I was crazy. They're like, yeah, you're going to open a restaurant and offer insurance. Haha, that's really funny, you know? And I spent a lot of time looking at the various options out there. And I looked at it, of course, from our budget and cost, but also the cost to our team. Because if it's outrageously expensive, I mean, you could find a plan that's, you know, $150 or whatever, if you shop around long enough. However, all the other costs, like the co-pays and all this other stuff, if they make the plan not useful, then what's the point in offering it? So I looked at it from that perspective too. Not only how much is it going to be for me, but how much is it going to be for the team? And will they be able to use this? So that's actually why we decided to go with the DPC plan, because you know what the cost is. It's very reasonably priced. There are no surprises. And like I mentioned, when I introduced myself, we pay 50%. We have a goal to eventually pay 100%, but we're kind of doing this in phases to make sure we can afford that. As everyone knows, we're in the middle of COVID. We opened a few months before COVID hit. So we're still trying to make it through this to understand where we're at and what we can afford. So this is kind of like our first phase. And then eventually, like Irene, we want to offer dental and vision too. We also feel like that's important. But we're starting slow and we're kind of easing our way in, and we want to add on more and more as time passes.
And I think you mentioned this before, but it's basically $35 for employer, $35 for the employee per month.
Yes, for the DPC piece. Now, if you were to add on Sedera, which is for surgeries and, you know, more serious treatments, and you're looking at anywhere from $126 a month to $294, depending on age and the deductible. They call it something else, but basically the deductible.
That part's also 50-50?
Yes.
Thank you so much. And I guess as just kind of as a follow-up in implementing this, and I think to a certain extent, $35 per month, not nothing, but it's a lot less than most sort of traditional health insurance plans. Was there sort of any tweaking of your business model that you did to kind of be able to make this happen? Or do you feel like it was able to sort of flow with how things kind of were as is?
We've been able to make it work. And I think one of the reasons for that is we're still trying to get people to sign up. So we have 36 people on the team, but only 5 have enrolled so far. And I think the reason for that is they're a little hesitant. They're like, what is this? Does this really work? Am I going to get good care? So the Dr. Larson's been amazing. He's going to come in and talk to the team. I've shared videos with them, and I try to talk to them one-on-one about this as often as I can. But they're still hesitating a little bit. But I've also noticed the more people that sign up on the team and talk about it themselves, the more others will sign up. So I'm also been encouraging that too. But yes, it's been doable, mostly because we know the entire team didn't sign up. If all 36 people signed up, then my response would be different, that's for sure.
Yeah, and that's the same for Mei Mei. Certainly, like I was saying, when I introduced myself, we have a lot of college students and folks who are still on their parents' insurance. But when we first implemented health insurance, we did spend a lot of time polling the staff on, did they have insurance in the past? How much were they paying for it? What kinds of services did they utilize most often? If they're still on their parents' insurance, when do they think they're going to be coming off? So we could try to like plan a few years out to have everybody covered. And then of course, we had a lot of part-time staff who didn't technically qualify. In some cases, we were able to make exceptions or set up kind of different arrangements for them. The monthly premiums paid by the employee for us range from about $90 to, I want to say $130 a month. And again, that's through Tufts here in Massachusetts. And I was also just looking back at our numbers. And when we had the highest level of enrollment, which was probably a third of our staff, the premiums paid by us represented about 1% of revenue. So that was the level that we're talking about. That year we posted 2.2% in NOP, in net operating profit. So 3.2 would have been great, but I think, what we're going to talk about a little bit later is like the impact on the culture and retention. And I definitely feel like we saw the returns there.
Yeah, no, and it's interesting looking back, because I think when I built out our healthcare program, I knew that our team would be pretty intimate. And we were definitely obviously don't run as a restaurant since we are more of an agency model. But we decided to do 100% of care, and we knew it had to be nationwide. So we kind of got pinned into being United Healthcare, Blue Cross Blue Shield, things of that nature. And we pay out of pocket to cover their base, $450 per employee per month. And so it really, when it starts scaling out, every time we built it in, we kind of prospect before even open doors, and like knew what it would take per employee to like have them come on board and like kind of just forecast out. And that's something that we work with a lot on operators who are either opening their doors for the first time or are trying to change their model. Is like, we really sit there and say, let's go back to the financials, because at the end of the day, having your company to employ is the most important part to have those margins. And I think that something that we talked about the other day is like, the one thing that was come out to bear from the pandemic is that everyone had to choose between compensation and wellness. And in the United States, it's really at odds with each other. And I just think that as we look at rewiring this kind of new future, I think that we're kind of at this inflection point that the American healthcare system is also in a pressure cooker to evolve. But it is so archaic that there's people who are going around it to create other different options. What I think is, Christine, we were saying, like, I think that's a great model, that the subscription model is like on the table now, and but it takes such an education to get people to opt in. And until you have participation, your principle shifts, so you have all of these kind of factors where it takes the operator so much education to get their team involved. And I think that's the one thing that hopefully, if it gets more normalized and more operators have it, that then it becomes like that barrier of entry gets ticked down and down, hopefully.
All right. And so for our second question, going to kind of talk about cultural implications. And so, what is the effect of these different approaches have on recruitment and retention of your employees, and maybe even just kind of anecdotally the sort of culture and feeling of the workplace?
Yes, for us, I don't think it's impacted recruitment or retention, to be honest, because normally when people apply at Rebel Cheese, they're applying because they believe in our values and our mission. They're coming for those reasons. They're normally plant-based themselves, and they believe in what we're doing. I've never heard anyone in an interview say, I applied because you offer health benefits or anything like that. And in terms of retention, like I mentioned a minute ago, since there's only a handful of people currently enrolled, I don't believe it's impacted retention. However, one good thing that I've seen is that, they don't have to worry as much. For example, our production manager, he has a newborn baby and she was sick a few weeks ago. And instead of trying to juggle work and school and the newborn and trying to figure out how to get an appointment, he was able to text a doctor and get some answers, within minutes that helped heal his daughter. So he didn't have to worry and he didn't have to take any time away from anything. He was able to get his questions answered fast and, his daughter's better again. So from that perspective, I feel like it's been a huge plus. And also the fact that, if someone does get sick on the team, they can get the care they need in a timely manner and actually get it without having to worry, how much is this going to cost me? Can I afford this? So the sooner they can get the care they need, the sooner they can continue on, with their lives. So from that perspective, I feel like it's been really positive. And that's, one of the reasons we want to offer it 100% is, it's one less thing for the team to worry about.
Yeah, I mean, I think to Elizabeth's point, it also comes back to this sort of like warring of compensation versus healthcare. And I think there's a lot of kind of like short-term versus long-term strategies kind of at play here. And I think, I certainly had that experience in my restaurant as well, especially, we implemented a no tipping model for quite some time. And I think it takes time for people to kind of really understand the long-term implications of some of these things. Because if you're just coming in to work a quick shift and walk out with $250 in cash in your pocket, it's going to be difficult to have this conversation about, hey, 5 years down the line, when you're still working this job, if you're still working this job and you want to start having kids and, the right to apply for a mortgage, that $250 in cash is going to really you're shooting yourself in the foot a little bit. And I think, we're going to get into this conversation a little bit in the next question as well, but just sort of the systemic and structural issues at play that make it difficult to convince our workforce that this is probably the trajectory that we want to kind of continue to propel down the line. Irene.
Yes, hello. Just thinking about that. So I think at Mei Mei, similar to what Kirsten said, I don't think it's been something that's helped us attract talent, but I do think it has helped us retain people. I think a lot of it has to do less with the actual access to healthcare and more with how it makes people think about the job. A lot of our industry jobs are not that well respected, not considered like, quote, real jobs. And I think that when you layer on the kinds of benefits that you see in other industries, it helps to legitimate what we're doing. And so for a lot of our staff, I feel like it gave them permission to stay. Because it wasn't a dead-end job where they weren't being cared for. I also wanted to add that, as our staff has grown and I guess the average age of our staff has gone up a little. I was 21 when we started the company. And so we are getting to these milestones where we have like the first Mei Mei baby on health insurance and stuff like that. And so that's the kind of thing that also puts pressure on us to make sure that we are doing the best job we can. And then one other thing I wanted to just share about that I'm really passionate about is the Massachusetts sick time law benefit. Sick time is something that every worker has to accrue, and it's really flexible how it can be used. And so we try to make sure that everyone on our team who has any need for sick time, or even if like they've just been really worn out and they're thinking about taking a personal day, making sure that they can use that. We don't have a sort of unified PTO policy, but we are very passionate about paying out sick time. So I think for us, in terms of the culture, in terms of retention, it's one of a sort of constellation of things that we try to do at Mei Mei that helps people stay. Because that little voice in their head or their mom or whoever is not saying, get a real job the way that they might have before.
Definitely. And I mean, on our end, I do think that the benefits that we've rolled out are very generous, and it has helped with acquiring great talent on our team and to keep them around. And I think that's everything from, we have obviously the health insurance, so we do 100% coverage. We do 12-week maternity, paternity and adoption leave. And then we also have other things that we've tried to trickled in over time, continuing education and things of that nature. And I think that those are things that we have 2 weeks off as we take off as an entire team mid-year and then end of year. And I think those were stuff that were just kind of put out in practice from the get-go. And we also have transparency into salary bands based off your level. So it's just one of those things where the expectation is met at the beginning, saying like, this is what we can do. And I do think that benefits now we're primarily about recruitment. And that's why healthcare went to the private sector. It's like in the 50s when they were trying to recruit, it became a recruitment tool. And now it's become retention. And I think the industry, and I can see people are doing it, adding in line items on their bills to pay for it and trying to offset that cost. So I do think we'll find it's going to get more and more interesting as people try to figure out other ways to adapt it when it comes to compensation.
And Elizabeth, do you mind speaking kind of, I know sort of early days of this benefits marketplace that sort of offering to both clients and non-client restaurant owners and operators. But as far as kind of like world application and, whether it's sort of more supplemental or how people are kind of actually in practice applying it. And, even if it's just as simple as employees really like it, or, kind of what initial reactions have been in these sort of first few months that you've launched this new program that I think is like, really unique and one of the only things like this that exist for our industry, at least.
Yeah. I mean, I think the overarching, the kind of the initial start was that we were looking at, if we had all these restaurants we're working with, could we all come under one plan and move forward? And needless to say, the American healthcare system doesn't allow for that. So we kind of quickly changed our direction and built this marketplace. And what it does is that it has everything from preventative care and things like ClassPass and mental wellness and everything where the employer is able to opt in on behalf of their entire team, regardless of part-time, full-time, back house or front of house. So it's just this blanket like membership. And then the employee can choose anything they want on it. And we did a lot of analysis of what was needed. So it's a bunch of things from Sesame for preventative care and Clear for dental. We have General Assembly for those who want to do continuing education on the digital marketing and that sphere, and kind of always thinking about the advancement. Urban Sitter for childcare, WAG for dog walking. So really address these issues that we're hearing, and all of these vendors came on from 15 to 50% off their services. And the thing that we're getting the most feedback on is we've onboarded like several of our clients in our team, and we're going to have a lot more information in a couple months. It's so new, but I think that it's just more of, people have the opportunity of picking things that otherwise is in one spot too. It's like you have this one entry point, you can choose anything you want and it fits your life. And it's totally anonymous. Like we know what's of interest. So we can kind of keep track of like, oh, that's resonating. Maybe we should think about more in that category, but it's completely anonymous who's in there, which I think is important because that's nothing that we want to know about. We're able to kind of keep evolving on it, but that's something that I'm going to know a lot more in about like 2 or 3 months. But thanks for the question.
Cool, great. And I know we kind of already started to scratch the surface of this, but as far as kind of obstacles to employee wellness, sort of given the current state of things and potential solutions, whether something that you've practiced or even just ideas for the future and kind of continuing to improve the state of things.
I think education's number one. Like I mentioned earlier, I know more people haven't signed up for this because they don't understand it. And in all fairness, it's complicated too. The subscription model, that's pretty straightforward. But when you start layering on the other plans like Sedera and dental vision, short-term disability, life insurance, I could just keep going and going and going. it gets complicated very quickly, and it can be overwhelming. So the more we can do to simplify things and, make sure these plans are as clear as possible, I feel like the better. That's my goal this year, is to find creative ways to explain what these plans offer. And again, phase them out, not phase them out, deploy them in phases. So let's start with this plan. And then once we've gotten into a cadence with this plan, okay, we understand what it is, let's add on this other one, like dental and vision, instead of, everything at once. Because it's overwhelming to me too. I spend a lot of time talking to a lot of different agents, trying to understand everything that's out there. And it feels like it's always changing, which is in some ways good. But I would say that's the number one obstacle that I've seen.
So I think one of our goals for this year is to start offering a retirement plan, so that, again, this is a real job and you could stay in it for a long time. And I think that that's something we were gearing up to do right before the pandemic. And then we were like, okay, great, we'll take this time to study up and, prepare ourselves. And then 2 years later, here we are, and we haven't implemented it because it's been so crazy. I think one of the things that I also think a lot about is just the impact of the work environment on our mental health in terms of stress. And I think that we have put a lot of work into reducing the amount of chaos our employees have to experience on a day-to-day basis. Making sure that roles and responsibilities are really clear, that everyone has their own assigned tasks. When we polled the staff about how much stress they experienced at work and how we could reduce that, a lot of it was kind of about communication. And that benefits us in so many ways when we step up our communication and make sure that everyone is always on the same page or as close to it as possible. So obviously that's very far upstream in terms of wellness, and it's not going to help you if you break your leg. But I think that having a work environment that is at least neutral, if not has a positive impact on a person's mental health, is a huge thing that we've really focused on. How do we make Mei Mei a place where you're excited to come to work every day and you leave feeling like you accomplished something and not just totally depleted, like I think I have in a lot of other jobs.
I think on our end, I do think this kind of communication transparency is so key. And I know, Irene, you mentioned even about, it's something I admired that you've always done, is the financial transparency that you give your community. And I think that the more understanding the team has of where, I think on the business, it's one specific moment, but I just think that really speaks wonders. But I think the one thing that we battle with is that we are fully remote, and trying to make people feel how do you turn off and how do you stop working when you're completely remote and digital, and being conscious of making time, trying to not send emails at night, not doing these things to try to make preach, do what you preach, or at least delaying them till the morning, whatever needs to happen. But I think that digital, because I think as we've gone more digital, at least on our end, it's been the lines get so blurred, where I call it work-life integration, where you're just always on call. And particularly we have 25 restaurants that are always on. So we have to figure out how do we create that kind of moment, those kind of mental moments for our team to turn off. Otherwise we could be on all the time, and just trying to create that. I think that to me is a big one that is going to be really hard for us to navigate as we are all digital and fully remote. And also feeling that sense of bond to each other when you don't see each other every day. I think that's the one thing I loved cooking and being in restaurants, is you had you walked in the door and everyone was there, and there's a camaraderie around that we're trying to build when you don't see each other. So we have classes, wine classes and coffee classes that our team teaches each other to kind of keep that water cooler moments available.
So I was going to kind of open it up to questions from the audience. You're welcome to just kind of come off of mute, or if you wanted to drop a question in the chat, please feel free to do that as well, either for all the panelists or anyone in particular that, maybe any kind of questions about their individual models.
I have a question. I was like,
Yes.
why is Andrea asking me to be on this panel? I don't get any of this stuff. I'm just like a person trying my best. I'm curious.
We all are.
Elizabeth, if a business is interested in learning more about Oyster Sunday, what should we do about your benefits platform?
Yeah, we have a bunch of information up on our website that we built, and it's oystersunday.com/benefits, but also my direct email is elizabeth@oystersunday.com. So I'm happy to answer any questions about it directly.
Cool.
Thank you for putting that in. Yeah,
Can you remind us how much per month it is right now for the access to the marketplace?
Yeah, we do it in tiers, kind of like 25, 50, 75, 100 team members, but it nets out to about $3 a person. So a team of like 15 would be $45 a month total, and everyone has access. And the only reason we do that is because we're taking all of that and renegotiating with our vendors to get the cost lower and to build, because we built it natively. So just to any upkeep and team to get everyone onboarded. But the idea is that the more people we have on it, the more leveraging power we have to renegotiate and keep getting these costs higher, lower as a team, as like a full industry. So that's our ambition.
Cool. And then Kirsten, I know we kind of talked about this before the call, but as far as, kind of these like direct primary care contracts, obviously, you have someone that you work with in Austin, but, across the country, someone was interested in pursuing a model like this, what would you kind of recommend as far as, finding someone in their area?
That's a great question. I thought about this after we last talked, and I realized I found their current DPC through Sedera. So I actually, when we were getting ready to open, I did a bunch of research in business groups, and that's how I found Sedera. There's another one like Sedera called Zion, Z-I-O-N. So this is the plan that, offers, critical care for surgeries, things like that. And then they referred me to the DPC that we're with. So I would start with, one of those plans because they're national, and then they can help you find a local DPC clinic. Although it doesn't necessarily have to be local, because a lot of them have these apps where you can do telemedicine and stuff like that. But of course, it's better if you can find one local.
And one thing to chime into here, I think that it's interesting because even when people are looking at how to offset the cost, there are also like qualified employer health reimbursement arrangements that people can, even if you're not having healthcare in your practice, you can actually offset, and has tax implications on behalf as an employer for your employees. So I think that's another alternative if someone's opting into the ACA or into another healthcare benefit, but you're not offering it. There are ways of reimbursing.
Cool. I think Julio asked, are limitations to enrollment, i.e. enrollment periods that you should consider?
The only limitation that we've run into is there's a limit on, or there's a minimum on the number of people that need to be enrolled, which is 5. So we're right at that. But that's the only thing that we've run into. And then the other thing to know, actually, if someone has like a pre-existing condition, for example, one of our other managers, his wife was expecting when they joined us, these plans can be challenging. This is when they're more expensive, in my opinion, because there is a waiting period with these cost sharing plans for certain pre-existing conditions. So make sure you look closely at what that is and what the cost is going to be, because that's where expensive surprises can arise. That's one area that I feel like they're not the strongest, but that's true for a lot of health plans.
It's amazing that qualifies as a pre-existing condition, is to be pregnant.
I know.
Just put that on the table.
And I asked him directly, how much how much will it cost them? And it's, like thousands of dollars, even with the cost sharing plan. So because they considered that a pre-existing condition. Yeah. So something to look at as, when you're researching options.
I have a question. Can I just speak? Okay, great. It's for Elizabeth. I run a bakery in Brookline, Massachusetts, and I am always thinking about sort of additional, there's baseline. We pay 50% of our health insurance, and we have paid time off. And I have this, wellness program that is a sort of $50 stipend for our staff to spend on chiropractic care or new shoes or whatever is promoting wellness in their life. But it seems like everyone needs something different, especially post, in year 2 of pandemic, it's sort of individual needs are even more heightened. And so I'm curious if I already have health insurance, and I'm not really looking to change that platform, but I want to give our staff one place to go to sort of get their individual needs. Is that sort of what Oyster Sunday is, or it's sort of all inclusive?
That's a great question. I think it actually was Andrea's question earlier. I didn't necessarily directly address, but
it.
no, I just don't think I actually answered the question directly. Yeah, it's much more of a supplementary benefit. So thinking about, there's healthcare and then there's everything else we all need. So we knew that we couldn't really tackle getting everyone healthcare, but there are things like preventative care that to me is much more telemedicine. You have a blank fee, you know exactly what it costs every time you get on the phone. So it's much more transparent, and it's not a cured monthly, principle or whatever. So that is what that is meant to be, but it has things like Tillet for aprons and Couturier for knives. So it's addressing like really what some fun things mixed with mental health, so it's both, it's the whole side of it.
Very cool. I'll be chatting with you more, I think.
Yeah.
Awesome. Any other burning questions before we kind of wrap up the panel? Cool. So I just quickly, if you have kind of like closing thoughts or anything that we haven't talked about that you feel like should get addressed, Kirsten, Irene, and Elizabeth, or not, that's fine too.
The only one I have, even being here today, like Irene said, I'm learning from everyone. So good work, Austin here has been amazing for that too. Adam's on here, I noticed he helps run that. Like I mentioned, like a barrier, I feel like it's complicated. So, participating in these groups has been so helpful for me, and that's what's gotten us to where we are today. So thank you for existing. Good work, Austin and Ray's. Is so helpful. Otherwise, I would still be lost, spinning my wheels trying to figure this out. So that's all I have.
I think just kind of like I said, we're all small business owners trying to figure it out. And I think too often in our industry, we're all just like reinventing the wheel on our little islands, treading water, trying to stay open and stay afloat and figure it out. And so I think any opportunities kind of have this kind of like camaraderie and ability to share, again, ideas and resources, and this works and this doesn't work. I think is it. It's kind of all we have. So really appreciate everyone who's here and was able to join today. Elizabeth, anything else to add?
I think the only little thing I'll say is that I think one thing you take away is all three of us have very different models. So again, there is no like prescribed path forward. It's like whatever makes sense for your business is the number one priority and your employees. But I'm a bleeding optimist. I think that we're ticking away at a pace that's much quicker than we did 2 years ago. And so I think that we'll find, and I think the more information exchange, the better off we're going to be to your point, not to be living in echo chambers and reinventing the wheel.
Awesome. Well, thank you all so much for joining us. We've got 15 minutes left in this call. I'm going to kick it off to Julio to go over a couple of updates. And then we also have pressure from Made to Save, who has some information to share with us about equitable vaccine access. So thank you again so much, Kirsten, Irene, and Elizabeth. Really appreciate you all being on here, and we will catch you at the next one. Julio, you want to take it away?
Sure. Thanks, Andrea. And thank you to our panelists. We've come a long way. I remember working at a restaurant and the employer telling me, you're lucky we give you a free lunch. We can charge you. So we're making big strides. Just want to thank everyone for being here. I put in the chat box our website. If you can check it out. If you're not a member, please sign up. It doesn't cost anything. We're really here to provide a space for all of you as resources. Every year in September, we usually go to DC in person. So that's a big value add. I want to introduce Precious. Right now, there's so much going on with COVID, surges, vaccine, and I think this is a great time to see how we can provide more resources for all of you or other partners so that we can get somehow, some way back to normal, quote unquote, if that ever is going to happen. So I'll turn it over to Precious. Thank you.
Hello, can you guys hear me? Oh, great. I've been having audio issues like all morning, so this is a blessing. So I will jump right in here. So my name is Precious Samuel. I'm a partnerships manager with Made to Save. Just want to thank you guys so much for inviting us here on your call today. And I'll try to make this really quick, but also super informative. So Made to Save is a national public education and grassroots mobilization effort to build trust in the COVID-19 vaccines and increase access for communities of color whose health inequities have been worsened by the pandemic. And we work with the national, state, and local partners all across the country. And in October, we were really excited to launch a program called the Vaccines at Work Initiative. It's in partnership with the Health Action Alliance. I am going to drop a few links in the chat here, like once I kind of wrap up. So the Vaccines at Work Initiative is in partnership with the Health Action Alliance to support businesses who want to implement vaccine policies in an equitable way. And it maintains trust between leadership and management and staff. And it's pretty much designed to help folks increase their impact and vaccine uptake inside of their workplaces. And we offer access to free business coaches, health experts, pro bono legal support, and we also have an impact guide that can help you determine how you want to increase your impact as a business through different buckets of actions that include learning, listening, engaging, and leading with your community at your workplace. We also offer policy templates, toolkits, digital access, as well as edible communication tools. And we host regular events, panels, and convening so that you can hear more about best practices and gain insight into what's working, what's not working, and how to overcome those challenges. And similar to the panel that you guys hosted today, we have something coming up in February that will get you the information out to, where we're going to be talking about Black communities, public health disparities, and COVID-19, and how we make sure that we have an overall wellness and health approach in communities of color that are in our workplaces. And so I'm going to drop a few different links here for you guys. So if you're interested in joining or learning more about the initiative, you can follow that link right there. That goes to our interest form. Make sure you fill the whole thing out so that we know how best to support you and your companies. Our partners at Health Action Alliance provided employers with a quick start guide that I think, based off of some of the conversations that I came in on, would be very, very helpful to you all as you start to think through your vaccine policies. And last and not least, we are hosting on January 27th, and we'll get these links to you guys in an email. Julio, I'll share them with you as well. we are hosting a communication training on how business leaders can talk to their workers about COVID-19 vaccines. We find sometimes a lot of people in the business community say, I don't know what to say, or I don't know how to say this, and I want to lead with empathy, and I want to make sure I'm being equitable. We have provided a very amazing training to business leaders on January 27th, where we're going to run through all the do's and don'ts, all the effective communication that you can have inside of your workplaces. And I just dropped the link to that training there. So I sped through. I don't know if I'm supposed to answer questions or not, but Julio, I'll turn it back over to you. But before I go, I do want to let you guys know, if you haven't already, the government released their link to for folks to request their at-home test. And so I'm dropping that link right there. So make sure that you request yours for your family. Make sure you send it out to your business listserv, your community. The link is operable at the moment. It may go down and then come back up, but that's to be expected because an overwhelming number of people want to do the best thing for their families and communities by requesting this test right now. So make sure you request the test and send it out to your workers as well.
Thank you, Precious. And I highly recommend everyone, take advantage of these resources because when you need them, the things are not available. I can go on. I tend to rant a lot, but yeah, I personally think the mandates that are going on in different cities are working. I won't share who this person is, but someone close to me was unvaccinated, and thankfully, because of a mandate, she wanted to go to the gym, she's going to get vaccinated. So slowly but surely, we're getting there. So as far as next steps, I will email everyone the links. Please share this with individuals. I'll also include the panelists' email if you wanted to get in touch with them. And then we're going to be doing this every other month. So the next meeting will be in March. So we'll circle back as to what that topic will be, but the goal is to make this as meaningful and productive for you, since I know you could all be doing so many things, whether it's running payroll or bringing up a customer. So on my behalf, on behalf of the team, thank you so much for joining us, and a big shout out to the panelists. Thank you so much for what you're doing, because again, we've come a long way from being told I should be thankful I'm getting a free lunch to having employers that are providing an opportunity for their workforce to have healthcare, which is super important. So thank you all so much. I hope you have a great day, and I will see you soon.